For joining us here. My name is Chris Picton. I'm the South Australian Health Minister, but also the Chair of the Health Ministers meeting. I'm joined by all of my state and territory colleagues behind me. Today we've just finished a meeting of the Health Ministers meeting, which has been very significant in terms of focusing on the aged care challenges that are impacting public hospitals across the country. And for the first time, we've now got the data of what that impact is right across the country. And we can reveal that there are 2,500 hospital beds taken up by the failure for people to be able to get out of hospital and into aged care. These are people who are medically cleared, who don't need to be in hospital anymore, who are waiting for a federal nursing home care bed, which isn't there. And that number is increasing and increasing across all states and territories. And that's why all the states and territories today have raised this as a key concern for the federal government and something that we need urgent action on, as our ageing population is only going to increase this pressure more and more. So right across the country, there are patients who are stranded, who are stuck in those hospital beds. It's not a good outcome for them to be stuck in hospital for months and months when they don't need to be. But this is also an awful situation for other patients who need hospital care. So this is the equivalent of having 3 Westmead hospitals across the country taken completely out of action because of this problem. Imagine if those 2,500 beds were there for other patients who need them, and the impacts that would have for other patients who need emergency care 24 hours a day to have those beds available. This is the equivalent of 880,000 nights every year of our public hospitals taken out of the system, and the cost is about $1 billion across the whole system. So this is an urgent issue, and it's something that we've raised with Minister Butler. I think we all work very constructively with Minister Butler, and we have good dialogue, but we're now getting to this point where we do need urgent action on this issue by the federal government. We have agreed today to undertake some urgent work, which is going to be led by Queensland, in better defining this problem and better collecting this data in the future. So you will be hearing more from us about this data. But Minister Butler, for his part, has agreed to work with us on what urgent actions could happen to try to address this issue. Federal government have been putting in place reforms which are starting to see some more aged care developed in the community and capital development, but unfortunately it's not happening fast enough. So we want to work cooperatively with the federal government to try to address this issue. We welcome the fact that following changes in the Senate last week that there's now going to be additional home care packages released, but we clearly need more nursing home beds as well for those people who are stuck, but also for every other patient who needs a hospital bed when they need it. I'll pass over to Meredith, who's hosting us here in Western Australia, and then available for the other ministers to say something as well, and we're all happy to answer your questions as well.
Thanks very much to Minister Picton. It has been a really important and constructive discussion today as part of the Health Ministers meeting here in Western Australia. Western Australia has been advocating to the Commonwealth the need to address the concerns that we have, that's shared by other states and territories, about the significant number of people who are in our hospitals, particularly older people, who are medically fit for discharge but are unable to find the care that they need. The discussion today builds on the visit the Premier and Minister McGurk and I, the visit we took to Canberra just recently to meet with both Minister Butler and Assistant Minister Ray, where we were advocating for Western Australia to receive more home care packages, which are an important way that we can discharge people from hospitals into care, but also to increase the work to make available the aged care beds that we know we need. Today in Western Australia there's more than 300 people in our public hospital system who are medically fit for discharge but unable to find the care that they need. And we know that hospital's not always the best place for them, that it is better care that they'll receive if they're able to be discharged to either aged care or discharged into a home environment with the appropriate supports around them. So we will continue to advocate with the Commonwealth. We'll work together with other states who are all experiencing similar situations and have expressed similar concerns today with the Commonwealth. Thanks.
Any questions for Minister Hannah or Minister Picton? Move on.
Minister Picton used the word urgent. Can you just categorise for me how urgent and how firm was the language used with Minister Butler. Were you satisfied with his response?
Well, look, I think it's fair to say that there's been some very robust discussions that have occurred, and I think states and territories have firmly put their views about the need to address this issue. And we've seen it in our hospital systems this winter, having large numbers of people in our hospitals, medically cleared for discharge but having nowhere that they can go, has created pressures right through our hospital system. So we understand that this is an issue that does need to be addressed, and I think the language that's been used today is firm. I think our resolve is very clear, but we are keen to work cooperatively with the Commonwealth. It's a problem that we need to work on together, but we do need to see action from the Commonwealth, and that's what we've been advocating for.
Were you satisfied with his response?
Well, I think it's fair to say that this is an ongoing piece of work. So it builds on the work we've already done in terms of visiting Canberra with the Premier and our Minister McGurk, our Minister for Seniors and Ageing, to advocate for the needs of Western Australia.
Were you satisfied with his response?
I think it's fair to say that this is an ongoing piece of work. We recognise that this is an issue that is going to require work not just today, not just tomorrow, but into the future as well, because we know our population is continuing to age, and in Western Australia our population is also continuing to grow. So we will continue to be very firm with the Commonwealth in terms of advocating for what we need. It's a concern that's shared by all states and territories, and we understand that this is something that needs to be addressed as a priority.
Should I take that as a no? You weren't satisfied with his response?
Well, I think what we're saying is it's an ongoing piece of work, and one of the things that we have had a commitment from the Commonwealth from is that Minister Ray will visit Western Australia. That's a really important part of also ensuring that he is hearing firsthand from our aged care providers here in WA and understanding their unique circumstances. We have talked about the need for more home care packages, and we welcome the announcement the federal government made recently to increase that. But clearly in Western Australia we have a large number of people who are waiting to receive those home care packages, and so there's still a need to improve the demand, to increase the supply of those here in WA. And of course we also need to make sure that we've got adequate supply of aged care beds, and so the state government has a program, our $100 million loan scheme, low interest loan scheme, to stimulate those beds to be built. But we do need the federal government to lead into this space. There is more work to do, and we're going to keep advocating strongly for what we need.
If discussions are still going, is this happening quick enough? You've mentioned before how urgent it is. Is this happening quick enough?
Well, I think we look back at the winter we've just experienced, and we understand that there are pressures in our system. Increasing the availability of aged care beds will assist greatly in terms of being able to meet the demands in our hospitals and in our emergency departments.
Acting quickly enough?
Well, of course we want them to do more. I mean, we've been clear about that. That's why we travelled to Canberra. That's why we meet here today with the other states and territory ministers. We want them to do more, and we know this is a need that needs to be addressed urgently.
So is this best case scenario then? Or if you're not going to say yes or no, it's ongoing, but the federal government can do more, is the outcome today best case scenario?
Well, I think this is a really important discussion. I think we've been very clear about bringing together the picture around Australia. So this is not just an issue that's affecting Western Australia, it's not just affecting South Australia. We also see the impacts of it in New South Wales, Queensland. And what we've heard today is that when you bring those figures together, it is a significant challenge for every state. So we do need to do more work. No one's suggesting otherwise, and we need to do that as quickly as possible.
Is there any rough timeline you can give people? Obviously this has been in WA, we've talked about lots of
Yesterday.
Yeah, look, I mean, we've obviously been working on this for some time. That's why we created a Minister for Seniors and Ageing, so that we could improve our advocacy in this space. That's why we visited Canberra with the Premier to meet with Minister Butler, to meet with Assistant Minister Ray. Today we've had a really strong statement, and the states and territories are very clear in that this is an issue that affects us all. We need much more investment into aged care, in terms of home care packages, also in terms of making sure that we've got adequate numbers of those aged care beds. So it's going to be something we need to keep working on. We do want to work constructively with the federal government, but we want them to do more. We've been clear about that. We do need them to do more, and that's what we're all saying today. I might hand over to
Can I just add something quickly in terms of the questions that Meredith was getting? I mean, time will tell. Time will tell if what the federal government is doing is enough. This is the first time that we've seen that data of 2,500 beds taken out of the system because of aged care. If we see that number going down, then we'll know that things are improving. If we see that number going up, then that's going to have more and more impact on our public hospitals across the country. It's going to have more impact on emergency departments and ambulances and people who need that care. So this is a very start point at which we see those numbers for the first time. We want to work cooperatively with the Commonwealth Government. We're hopeful that things will improve, but obviously time will tell.
Is the data the Queensland Government's working on going to show any estimated projection of if things stay the same, what the aging population
I don't know
will
if
be?
Tim, you want to say something?
Thank you. Well, like all the other states, Queensland is under an enormous amount of pressure regarding long-stay patients. We've got over 1,100 long-stay patients, and of that cohort, 880 are older patients who are awaiting care packages to get out of our hospitals, and that's obviously not ideal. So I think what you're seeing for the first time in a long time is all the states of all political persuasions coming together to make the case to the Commonwealth. And quite frankly, the system is not good enough. In terms of timing, it's not good enough. The numbers have grown too quickly and too little has been done. So this is a great opportunity to present that case to the Commonwealth, to be able to point out to them, because of the great work that South Australia has done in collating these figures, just how bad the situation is, and to make the case for change. And we don't want to let the perfect be the enemy of the good in coming to a resolution of that. And in doing that, we need to know what the classification is for long-stay older patients and how we count them. Each of the states does it slightly differently. The work that Queensland will lead and present back to health ministers in December will hopefully harmonise that, and that will strengthen our arm in the case that we need to make to the Commonwealth in relation to the packages that they need to offer. Now, whether that is in relation to dementia care, which is particularly a sticky problem for all our hospitals, concessional care packages, those are the important things that we will be able to put in front of the Commonwealth if we get the counting right and if we get the definitions right. Now, in Queensland, for example, we've got a First Nations patient who has been in our hospital in Townsville, in Cairns, I should say, for 690 days. And that's just unacceptable. We've got a stroke victim who's been in hospital for 450 days because they cannot get into aged care facilities. And these are not third world countries. We should be doing better, and we should be delivering better outcomes. Counting and defining the problem is really a key step to being able to address it.
Mr Parker, can I ask
Yeah.
you said yesterday that it needed to be done yesterday. Can you
Well, it does.
characterise the urgency? And I did just want to put to you something that WA Premier Roger Cook said the other week. He said that this is a nationwide problem, that he'd been Googling overnight and found the headlines, ramping crisis in South Australia and New South Wales. In New South Wales, you have had some luck turning the trend around lately, but T2 on-target treatment times are still below 40%. I mean, in 2025, that's just unacceptable, right?
Well, what's unacceptable is that we have close to 1,000 patients in New South Wales hospitals that shouldn't be there. It's terrible for them, it's terrible for their families, it's terrible for the staff, and it's terrible for the system and the communities that rely on accessing healthcare. It's not good enough. I've been raising this for 2 years. I'm going to continue to do it. I don't really see why we can't be doing more to address this problem. Now, what I'm relieved about today is that Minister Butler has given a commitment around a willingness to work with us on more short-term options. Because, to be frank, if we wait to see the number of beds that we need to be built, this problem will just get worse and worse and worse. I'm not prepared to do that. New South Wales is investing millions of dollars, tens of millions of dollars of state taxpayers' money that normally should be funded by the Commonwealth into programs like geriatric outreach, trying to get our patients out of those hospitals as quickly as possible. Now, we've been able to keep it what I'd call at a steady state, far from acceptable, certainly not acceptable to the patients who are experiencing it, not acceptable to the families, but also not acceptable to the community who can't access beds in our hospital to deliver acute health services. And that's what hospitals are designed to do. They were never funded, they were never designed to be aged care homes. That's not the way it works in this country. So we've got to get back to a situation where the Commonwealth takes the load for aged care and we do the delivery of acute health services.
Notwithstanding the aged care problem, but given you've been raising this for 2 years, you just said Australia hasn't aged overnight, should all of you have built more hospitals faster?
Well, it's not an issue around hospitals because these people have essentially had their time delivering acute care being delivered to them. So they're beyond that. So it's not a hospital bed issue. One of the issues is that they're stuck in a bed for too long. So they shouldn't be in hospital. It's not good for them, it's not good for their family, it's not good for the staff, and it's not good for the community who rely on health services. That's the challenge here. Now, what we're saying is that, yes, we support what the Commonwealth is doing to get more beds in, but that won't happen quickly. What we've got agreement around today is that there needs to be looking at some bespoke models around how we might be able to do things in partnership with the Commonwealth in the short term, I would say in the immediate term, to be perfectly blunt, in the immediate term from my jurisdiction's perspective, to try and put a dent in this and to try and get the graph going down, not up. Because if we don't get that, we're going to continue to see people have problems accessing our emergency departments. We're going to continue to see older patients not get the level of care that they need or not be at the place where they're getting the level of care that they need. And we're going to continue to see pressure on our frontline healthcare staff. So it's not good for the patients, not good for staff, not good for the system or the community.
Can I ask you if you were satisfied with Minister Butler's response today?
Well, I won't be satisfied until we start to see in New South Wales a drop. So my benchmark is very clear, and I want to make this very clear. When I start to see the numbers go down, based on the initiatives that we're working on together, then I will start to say that we're moving in the right direction. I am not satisfied that we are moving in the right direction at the moment. I'm not going to pretend that we are. I was asked to give this a priority in terms of the biggest challenge facing the health system in New South Wales. I probably put this as number one, along with our workforce, which is always right up there as well. So this is a massive issue for the healthcare system in New South Wales, and therefore it's a massive issue for me as the Health Minister, and it's a massive issue for the community who rely on health services across the state.
Guys, ask a couple of questions if there are any, so we can get everyone
Mr.
playing.
Pickett, if I could ask you, one of the data points that you put forward was aged care places per 1,000 people over the age of 70. They've lowered in the last 3 years for every state and territory. This morning, Mark Butler said that we adopted a bad system from the coalition. Was it frustrating to hear that, given that there's been basically no improvements made over the last 3 years?
Oh, look, I mean, I think he's probably right. I mean, clearly aged care has, these issues haven't arisen overnight, but we need to see some urgent action to address this. Otherwise, it's just going to keep getting worse and worse and worse. And here we're talking about people who have paid taxes their whole life, good Australians who, when they come to the time where they need aged care, deserve to be able to get into a nursing home. And they can't, and they're stuck in a hospital bed, which is not a good outcome for them and not a good outcome for the rest of the people who need that hospital bed.
You've been quite defensive of the federal government's work with aged care. Has the situation become so desperate that now it's time to shift that blame back to them?
Oh, well, I mean, clearly we are all standing here united saying that more needs to happen. We are extremely concerned about this situation that's happened in aged care in this country, and this is a national problem. Every single area of this country, our hospitals are becoming clogged with people who deserve to be in aged care but are stuck in our hospitals, and it means that other people can't get the care that they need.
What was the turning point for you, though?
Well, I started raising this issue when we had about 140 people stuck in our beds in our hospital system. Met with Minister Butler, we've been talking about this for the past 18 months, and in that time the number of people stuck has doubled to 280 in South Australia. And I don't want to be in a situation where that's going to double again, because that's a bad outcome for those people who get stuck, but it's going to mean all of our public hospitals across the country are going to be in a much worse situation.
Minister Hammett, can I ask you
Sorry?
There's just mention of some short-term immediate options that could be taken. What will those actually be like, and are you convinced that it'll actually happen?
Well, again, time will tell. We're talking about, whether there could be prioritisation of the high care packages in the home that could be prioritised for these people. Work that the Commonwealth Government could do to incentivise fast construction of new nursing home places across the country. All of these things should be on the table. At the moment, capital funding from the federal government is only tied to regional areas. So metropolitan areas like Perth or Adelaide or Hobart that face these significant issues can't get access to those funds to help expand aged care. All of this needs to be on the table.
So nurses
The nurses are actioning for a better, they're threatening to escalate for a better offer. How concerned are you about this?
In South Australia.
Yeah.
Look, we'll continue to work constructively with the nurses in South Australia. Just like we've done with allied health professionals, just like we've done with doctors and reached agreement with them, and we want to work constructively with the nurses too.
Minister Hammett, can I ask you about lead, please? With apologies, I would love to speak to everyone else too, but you tabled full data in Parliament last night. Why did it take so long? And you have now announced a new protocol for the Chief Health Officer to report to you monthly, but you haven't committed to a process to make that data public all the time. Why not?
Look, we've made the information available because we understand the interest in this issue, and of course that's why we've also put in place that new protocol so that there is across our hospital system a mechanism for the health service providers to report up to the Chief Health Officer. Now, he will advise me where there are results that are a concern, and as part of that I will get information from him about how to then make those appropriate discussions with people who might have been affected. So we'll take his advice. I'm not prejudging anything that might come from that new procedure that we've put in place. And I'll follow his advice in terms of how we do it. I just want to really reiterate though, our hospitals are safe. We do have very rigorous testing in place, but I want to make sure that there's a system where that information is coming together and to ensure that it is fed up to me where there are issues where people have potentially input.
Just mentioned very quickly that we received a review into the IVF sector that we commissioned at our last meeting in June. And we accepted all of the recommendations out of that review. A series of recommendations that will deliver more independence, more transparency and the highest possible quality of care to the many thousands of families who are seeking this sector's help in helping them build a family. And there is no greater investment of hope and confidence that I can imagine people making into a sector than the investment of hope to help build a family. I know as a father of a beautiful IVF baby myself that the damage to confidence in this sector over the last several months demanded that health ministers take action. So we want to see an independent accreditation system, and we decided to do that at this meeting after that rapid review. We want to see the highest possible standard right across the country so that every family can be confident they're getting the best possible care and support from this sector. And we want to see much more transparency as well. So I thank the health ministers for their agreement to do this review, with Victoria particularly leading it. And I also say that we had a great opportunity to discuss the federal government's latest offer for hospital funding going forward. As people know, we're investing huge amounts more into Medicare, the strength of Medicare, more doctors, more nurses, more bulk billing, more urgent care clinics. We're also investing record amounts into aged care. And today we had a chance to discuss our offer to invest $20 billion more into our hard-working public hospitals. Obviously, we've got a long way to go with negotiations. Those negotiations don't just encompass hospital funding, they also deal with NDIS reform and our commitment to building a thriving kids program for children under the age of 9. But this was a really good opportunity to have a discussion with my health minister colleagues about the common issues we have going forward. Happy to take questions.
So what states signed up for the Thriving Kids program and not why not?
Well, all Premiers, Chief Ministers and the Prime Minister 2 years ago now agreed to recommendations from the NDIS review, the independent review of the NDIS, to create a system of what they described as foundational supports, and in particular, a system of supports for children under the age of 9 with mild to moderate needs around developmental delay and autism. That work, frankly, has not proceeded as quickly as I think it should, which is why some weeks ago at the Press Club I leaned into it a little bit more than maybe the Commonwealth had been to date and indicated our determination to get that work moving. That will be work that is shared between jurisdictions. The National Cabinet, the First Ministers of all of our governments agreed to split that funding 50-50, and I'm determined to do that work over the course of the rest of this year.
Do you have any states or territories on board yet?
Well, as I said, Premiers and Chief Ministers agreed to this work. We've written to Premiers and Chief Ministers proposing a way forward to develop the design of that program. I'm very confident that we're going to make real progress over the coming months.
What is the sticking point? What are the sticking points that your colleagues, statutory colleagues, bring to you?
Well, I mean, what I heard when I first was appointed to the Disability and NDIS portfolio were two things from states and territories. Firstly, they said that they didn't think the Commonwealth was leaning into this enough and instead was leaving the design of this program up to individual states and territories. I heard from stakeholders themselves, from families and service providers, that they wanted the Commonwealth to lean into it more to ensure there was national consistency rather than 8 different schemes built up in every individual state and territory. And I also heard from states that they were concerned that our funding was only committed for 5 years rather than on an ongoing basis. And my speech to the Press Club some weeks ago, where I outlined our determination to design a Thriving Kids program in partnership with states, responded to all of those concerns.
State health ministers say that 2,500 aged care patients are basically why hospitals are overcrowded at the moment, and the problem is getting worse and worse. Minister Park said he's not satisfied by the response so far. What do you say to that?
Well, I agree. I agree with my state and territory colleagues that we need to see more building in the aged care sector. When we came to government, this was a sector in absolute crisis. There was no building of new beds going on. Staff were leaving the sector in droves. There were huge wait lists for home care packages, in spite of the fact that we knew that the demand for aged care was about to skyrocket as the oldest of the baby boomer generation started to hit that age of entry to the system in their late 70s and very early 80s. So there is no area of policy where we spent more energy and more money in our first term than aged care.
The state ministers acknowledged that you were left a mess in aged care, but they did say that you've been acting too slowly as well. They said they've been raising this for 2 years, and they said action should have been taken yesterday. Do you accept your share of the blame for slow progress so far?
Well, I accept that we are responsible for aged care, but we have crammed a decade of reform into 3 short years. Providers frankly said they found it difficult to keep up with the pace of change that we were demanding of them. But if you look at the aged care sector now, they're recruiting, they're retaining the workforce they need. We've got more home care packages than we've ever had in the system, about twice as many already as we had only 5 years ago. And although the build was operating far too slowly, we're starting to see signs, having passed our new Aged Care Act at the end of last year, that the build rate of aged care beds is starting to climb quite significantly. Now, it's not climbing fast enough, and we still do have a backlog of demand that we need to work with states and territories on. And I think we've had a really good discussion over the course of last night and today as well about some of the more short-term arrangements that we can put in place to help relieve some of the pressure that my colleagues have talked to you about. I mean, we have invested about $600 million over the last period of time to fund different services that ensure that older people are able to be cared for out in the community instead of admitted to hospital in the first place. Those things are having an impact, but I recognise there's much more we need to do to build an aged care system that is fit for the sort of demand that is coming down the road.
Is there an element of deflection from the states? Do you feel like you're a scapegoat?
No, I accept that we collectively have to do more. I mean, as we build some of these systems, we're going to need cooperation from states and territories. The discussion I just had with them indicates they want to work with the Commonwealth on this. They recognise, frankly, the mess that we were inherited after the Royal Commission had described the aged care sector in one word: neglect. An area, a condition that was frankly compounded by the impact of the pandemic. I think the states recognise the work we've done over the last 3 years, but I recognise their frustration that the aged care sector is not building the beds at a pace we need them. We need to do more to make sure that happens.
So how long will it take to turn that around, and can you give the public a target date that we can hold you to account for?
Well, I'm not going to give a particular target date. I think the sector knows the sort of numbers that we need in terms of new beds into the system every year to accommodate the new aging baby boomers that are coming into the system. We're not there yet, we're far from it. My sense, the reports I'm getting, is that the number of beds being built next year compared to this year is significantly significantly higher, close to twice as many. So that means we're going in the right direction. But we had a really good discussion with health ministers in the room just now about ways in which we can deal with the period between when those decisions are made and when the bed's actually open. Obviously, it takes some time after a decision is made to build a new facility to get it up and running. You actually get the doors open. We need to recognise there's a gap period there that we need to work together to fill.
An aged care provider here has asked the Premier for $100 million each year for the next 10 years. That's obviously just in WA. Do you have any idea how much it would cost to even fix the 2,500 marks that we have at the moment?
Well, we work to, I know the provider you're talking about, I've seen those media reports. I've known that provider for probably 20 years and worked closely with him and his company, and I've had discussions with him and providers right across the country about what we need to do as a Commonwealth to change the policy settings to make this sector investable. We took that advice, we passed that legislation through the Parliament just before Christmas. Now we need providers to put their money where their mouth was last year and start making plans to build these new facilities.
When you say there needs to be collaboration between state and federal, are there any levers that state governments aren't pulling that you want to see pulled to improve aged care?
Well, not aged care homes particularly, but we need to work. I mean, I think we've worked really well on trying to ensure that people who don't need to go to hospital are able to be cared for in the community. We've rolled out 90 urgent care clinics right across the country. We've got another 47 to roll out. Tenders have closed for them. That is diverting activity from emergency departments. We've got programs that we're funding for states and territories to deliver to try and ensure older Australians aren't going to hospital unnecessarily, including from aged care facilities. That is having an impact. I think the challenge we all recognise is really once older Australians are in a hospital, that getting them out of a hospital after they're medically able to be discharged is not proving as easy as frankly it should be. And that requires more building of aged care beds and in the interim, before they open, some innovative thinking that I think we discussed really cooperatively and constructively today about how to deal with the gap.
Any dollar figure though that you think the federal government is looking at here?
No, I'm not going to put a dollar figure on it. I've said to states that we've put a very generous offer of hospital funding on the table, $20 billion more than states would receive for their hospitals if they continued with the agreement, or if we all continued with the agreement that they signed with Scott Morrison. This is a generous offer on top of the record investments we're making to Medicare and in aged care. And if they want to talk about some additional measures in relation to longer stay older patients or people, older Australians who are in hospital longer than they medically have to be, then we're happy to talk about that in the context of those negotiations.
Will WA get a per capita share this time?
Well, WA's got a per capita share of the funding that we've put in place to help with older Australians in hospital through the Strengthening Medicare. Through the Strengthening Medicare agreement that Commonwealths and states and territories agreed the year before last. That was distributed on a population share basis. Thank you.
Sorry, just one last question. You came under strong criticism from state and territory health ministers over linking federal funding to hospitals to that MBAS reform. Does your government remain staunch in that? And if so, why? Why have you opposed that kind of funding model?
Well, I didn't link the two. National Cabinet did. All of their bosses, for those ministers who've made a complaint about that, all of their bosses signed on to a National Cabinet deal in December 2023 that linked the negotiation of a new hospital funding agreement to our shared commitment to NDIS reform. That was a very clear decision made by the Prime Minister, all premiers, all chief ministers, and of course, as a minister, I'm working to that direction. Thanks very much.
Thank you.